Hello and welcome to my health and wellness channel. I'm Dr. Gauri Bhire and I'm a medical oncologist. We've been talking about various supplements that people commonly take, and today we are continuing our series on nutritional minerals. Minerals are inorganic compounds that our bodies need to carry out important physiologic and metabolic functions. Nutritional minerals are different from geological minerals, which are rocks and stones and even gems like rubies and sapphires. We don't consume rocks, but we do need to consume nutritional minerals. Some we need only in trace quantities of less than 100 milligrams daily, and examples of these are iodine and fluoride, which we will talk about today. We have previously talked about iron, and I encourage you to refer back to that video for more information. Before we get to iodine and fluoride, I want to briefly talk about manganese, which is another trace element, and because it affected my family and we personally experienced the toxicity that manganese may have contributed to. I do want to point out that we should not confuse magnesium with manganese. We do need to consume magnesium, but we only need manganese in such trace amounts that we don't actually have a recommended daily allowance, but rather a safe upper limit of intake. Manganese is an important component of some enzymes that are involved in energy metabolism, but humans are rarely deficient as most grains, vegetables, fruits, nuts are excellent sources of manganese. The real risk is in toxic industrial exposure in the welding or steel industries, or from drinking well water with a high concentration of manganese. It can cause neurological damage, and this can cause symptoms like Parkinson's disease. And sadly, we got to experience this firsthand as my father developed a neurological illness to which he eventually succumbed. He was really not fitting the diagnosis of Parkinson's, and the medicines didn't work for him. So my mother valiantly and diligently searched for a diagnosis and treatment. One of those tests showed very high toxic levels of manganese, and we knew that he had had industrial exposure many decades earlier, as well as possible well water exposure. In the modern era, we are aware of this problem, and we hope that manganese toxicity will only be of historical interest. My note of caution here, and my reason for bringing this up, is mainly because some people take mineral supplements because they've heard that they may be deficient in trace minerals and that may be good for their health, so they take the supplements. However, if they've not been tested and they are not actually deficient in those minerals, they could be causing toxicity. So unless you have a medical issue causing malnutrition, you get plenty of trace minerals in your diet. Use these mineral supplements with caution and only if you need them. The minerals that you may be familiar with are iodine and fluoride. What makes iodine important? It's a critical component of T4 or thyroxine, a hormone produced by the thyroid gland, which is located in the front of your neck. T4 and T3, which is an active form of T4, are drivers of metabolism and especially in regulating our basal metabolic rate. The thyroid gland functions in a feedback loop with the pituitary, which is the master hormone regulatory gland in the brain. If the body does not have enough iodine, then the thyroid gland cannot produce enough thyroid hormone. The lack of thyroid hormone feedback inhibition makes the pituitary produce more thyroid stimulating hormone or TSH. This forces the thyroid gland to enlarge and to try to produce more hormone in this feedback loop system. You may have seen people with enlarged thyroid glands called goiters, and when you have your physical exam, your doctor is feeling for a mild enlargement in the neck, which can be a subtle goiter. Goiters can be subtle or goiters can be massive, and unfortunately, about 150 years ago, these massive goiters were sometimes used as circus attractions. Besides the physical problems with a large gland in the middle of your neck pressing on your airway and food passage causing obstruction, the lack of thyroid hormone drives down your metabolism and makes you sluggish. When we replace thyroid hormones with pills, the feedback to the pituitary decreases the TSH. That is how we measure that we are replacing your thyroid hormone adequately and adjust the doses according to your TSH level. Some people are very sensitive to changes in their levels and can feel their energy difference with slight fluctuations. I know someone who insisted that her TSH be maintained at a lower level, enabling a higher thyroid replacement dose because she could tell the difference in her energy with even those small differences. On the other hand, I had a patient many years ago who had finished her breast cancer chemotherapy. She came for her routine follow-up and she said she felt a little tired and she attributed that to her chemotherapy. I decided to measure her TSH and thyroid hormone level, and these levels were so off we had to urgently consult an endocrinologist so we could safely and appropriately replace her hormones. This, by the way, was not from her cancer treatment. I saw her about a month later and I thought she would be feeling incredibly energetic because now she had adequate levels of thyroid hormone. And her answer was surprisingly, not much. Go figure. So, how do people get iodine in their diet? Iodine is found naturally in drinking water, in vegetables, and seafood. To make up for dietary deficiency, often table salt is fortified with iodine. Iodine is readily absorbed in the intestines, and what the thyroid doesn't use gets excreted through the kidneys. Children who have iodine deficiency are often afflicted with mental retardation and also often suffer from increased neonatal and infant mortality. Can you get too much iodine? There are sources of excess iodine in over-the-counter medications and dietary supplements like kelp and seaweed. It doesn't matter to a normal thyroid gland because what it doesn't need, it doesn't take up. But if you have an underlying thyroid disorder, it doesn't process the excess iodine efficiently. And you may end up with an abrupt excess of thyroid hormone production, which is a bad thing. The next trace mineral we are going to talk about is fluoride, which is the ionic form of fluorine. This is the 13th most abundant element in the Earth's crust. It is released into the environment naturally, both in the water and in the air. It is considered a beneficial but not an essential mineral. It does have an important role in preventing dental caries, which is a bacterial infection of the teeth, commonly known as cavities. The antibacterial action of the fluoride is due to the acidification of the bacterial cytoplasm through the formation of a hydrogen ion and a fluorine ion from hydrogen fluoride and the disruption of the bacterial metabolism. The variability in water content explains much of the variability in total fluoride intake, as you can see in this map. And because of this variability, many domestic water supply systems are fluoridated to decrease the prevalence of dental cavities. Some people object to the added fluorine in their drinking water supply because it takes away their choice. But dental infections are not only bad in themselves, they also contribute to many other medical problems. Other important sources of fluoride are tea, seafood that contain edible bones and shells, medicinal supplements, and fluoridated toothpaste. Fluoride is efficiently absorbed through the gut and excreted in the urine. 99% of our body's fluoride is contained in our bones and our teeth. In the bones, it increases osteoblastic activity, and osteoblasts are bone-producing cells. This is required to increase as well as to maintain bone density. However, chronic increased consumption of fluoride can lead to unwanted effects. Dental fluorosis is a cosmetic disorder where the teeth become mottled in coloration. and excess fluoride can actually cause brittle bones and calcifications of ligaments and cartilage. We can be exposed to toxic levels if our water supply contains too much fluoride or by inhalation or skin absorption through industrial exposure. The American Dental Association does recommend that children under 2 years brush their teeth with water only, and between the ages of 2 and 6 only use a pea-size amount of fluoride toothpaste. Thank you for watching. We will be moving on to other topics after a couple of more minerals that we will discuss in our next session. So do subscribe for more interesting and useful information coming your way. Take care and be in good health.